Welcome, everybody. Um, so last month we had genomic and genetic testing and understanding the differences and some things that employers would have to think about. So that was kind of a heavy topic. There is a recording of that topic, I think, on Kelly's, the University Conference Services website. Today is going to be a little bit more relaxed topic, just kind of going through the state of the marketplace today. There's a lot of stuff happening. I'm sure I don't need to tell any of you that. It's been difficult to keep up. Certainly every morning reading the headlines, some headlines have given me pause. So we're going to tackle and kind of have a really good 30-minute session on just what's going on, what does it mean, and really, trying to help you frame things macro instead of micro and looking at every news headline individually, kind of looking at them in totality and making sense of what is really the momentum in the marketplace. So we have a ton going on, the pharmacogenomics, the immunotherapies that are coming out, potential million-dollar drugs for cystic fibrosis and some cancer treatments. We have a migraine specialty drug that hit the market 2 months ago that's $7,000 a month. So we're going to talk a little bit about, kind of what's driving the industry and kind of take a step back again from a macro perspective and make sense of it all. So hopefully. Our thoughts and prayers are with the people that are going to be dealing with Florence. She is coming straight at the Carolinas. And I know that it's a very scary time for some, especially along the coast. So I hope everybody's safe. Speaking of which, the weather and climate disasters in the U.S. last year cost over $300 billion with a B in dollars. And again, kind of taking a step back and saying, what does that mean to us in the healthcare market? Some of those insurers that are covering those losses have businesses that touch us as well, like the stop loss area. So when you think about it, those companies obviously have a book of business that they spread their losses across. And the stop loss market is definitely already a tight market with some of the pharmacogenomic specialty therapies that are very, very expensive. Some of the specialty drugs that are now over $1 million a year. So some of those stop loss companies are also dealing with losses on the P&C side, the property and casualty side. So something to kind of take a step back and think about. 1 year ago today, our national debt hit a historic 20 trillion mark. Again, as a macro perspective, one of the things that I think are hitting large businesses and small businesses in the U.S. is that benefits are second to payroll, and we're still trying to struggle with, how we pay for benefits and keep everything in check. The GOP, the Republicans, are obviously dismantling or trying to dismantle pieces of Obamacare one little bit at a time. So we have the end of the individual mandate. And really, again, from a macro perspective, what does that mean to us as employers trying to cover our employees for healthcare benefits? There's over 13 million people that get benefits through the public exchanges. And as the individual mandate and they chip away at some of the pieces that make up the state exchanges and the federal exchanges in some states, it becomes less and less competitive or profitable for insurers to be in those marketplaces. So my guess is that rates are going to continue to rise on the public exchanges just due to the dismantling of the individual mandate, which reduces the good risk that's left in the risk pool. Interestingly, going into the next election cycle, we're going to hear a lot more, I think, about Medicare for All. So there's been a couple of really good articles in Time Health Magazine and the Wall Street Journal in regards to what Medicare for All means. I was a little bit surprised that, even though I didn't feel the burn for Bernie Sanders personally, I know that I did support his idea of Medicare being available to the public on the public exchanges, both the state exchanges and those in states operated by the federal government. It made a lot of sense to me to have Medicare as an option to the public, so the for-profit insurance companies. And the reason that is because the insurance companies are for-profit companies trying to make a profit on bad risk, really, is what it comes down to. Medicare is something that if we could make that available to people under 65 at a cost, it seems to me that that would make a lot of sense as an option, since we don't need a 20 to 30% profit margin on that book. And I disagree. I guess I'll be a little opinionated today, and I disagree that a government-run option like Medicare would be socialized medicine, right? Because if you talk to most people over 65 that are on Medicare today, they don't feel like they're on socialized medicine. As a matter of fact, my parents love Medicare. They cover everything. They have almost every doctor and hospital as an option. So we'll be back to talk a little bit more about that, I think, later in the year, as that kind of becomes a more established idea or policy promoted change for the future, if they're going to try to make that through. Debt carried into the workforce. I did want to just pop this in because I think it plays into what's happening in our marketplace. So 70% of graduates graduate with student loans, and the debt has increased at an alarming rate. So much so that NYU just announced last week that for medical school, they're waiving the cost of tuition. And they said it was a social mandate because more and more students are going into the fields of specialty care, where they can earn higher incomes to pay off their student debt. So NYU is hopeful that a move like this will reduce student debt and more students will move into lower level specialty areas like primary care physicians and things that are much needed in our country today. And that kind of brings me to the next slide. It's interesting to see what's happening in the marketplace, because I think a lot of this is driven by, obviously, profit margins, right? So if you look at the first 6 months of the year, actually the first 3 months of this year, a lot of acquisition activity in our marketplace. United Healthcare is the largest insurance company in the country, and they made a move to purchase one of the largest physician networks. CVS obviously made a play for the purchase of Aetna. Amazon, Berkshire Hathaway, Morgan Chase Bank, they're trying to consolidate and create for their employees right now a new model of healthcare delivery. So if you look at, and then Cigna with Express Scripts. So if you look at this acquisition and merger activity, it really says to me two things, and probably says a lot more than two things. But I think the biggest things that really resonate with me is that in the marketplace, the largest insurance companies are trying to pull back in the pharmacy. So if you look at large employers, 60 to 70% of large employers, meaning employers over 500, carve out pharmacy if they're self-funded. Obviously not an option to carve out pharmacy if you're fully insured, because there's no stop loss for pharmacy only. But if you're self-funded and you carve out pharmacy and go direct to a PBM, typically you got better metrics, you got better performance guarantees, and you got better pricing. And if you look at the consolidation that's happening in the marketplace, the large insurance companies are coming back together with the PBMs, and that could mean positive changes for the insurance market, right? So if you look at, if you had it carved out, some of the challenges were reintegrating the data, getting the data back together for disease management and clinical management programs. Although today that happens on a daily basis, so that shouldn't stop anybody from carving out, but that's one of the challenges in carving out. And then the second thing is pricing. So we're hopeful that this is an anti-competitive movement, but it's more competitive movement. But I think at the end of the day, it remains to be seen, right? So we're going to see if we get more competitive pricing from a Cigna ESI arrangement or a CVS Caremark Aetna arrangement. It really, again, remains to be seen whether they can be as competitive as carving it out. So those acquisitions and changes should hit us in 2019 and 2020, and we'll keep our eyes on that. And then I guess the second piece to that, so that's the first thing that I see happening in the consolidation in the marketplace. But the second thing is really looking at what the marketplace wants, right? So if you look at the CVS Caremark or CVS Health Aetna acquisition, they're looking at reducing retail space in the CVS drugstores and putting more minute clinic opportunities in. That's one of the expansion initiatives that's going to take place, because people don't want to wait 2 to 3 months to get a primary care physician appointment for wellness. So millennials, of which there's 55 million millennials in the workplace today, they look at their phones and they say, I want an appointment next Tuesday at 10 because that's when I'm available. And these minute clinics might serve that need. Amazon has actually tackled the same initiative, right? So Amazon, the whole premise of Amazon, and especially Amazon Prime, which still amazes me today that you can order something today and get it delivered tomorrow. But they're trying to do the same thing with their employees and a more focused approach on customer service, getting people the proper care and service in a more immediate setting via virtual physician, teledoc technology, and some of the things that they're looking to deploy for their employees. And then if you look at Amazon in general, they're looking at expanding the over-the-counter drug purchases online through Amazon Prime. So that's also a change. So if you look, in totality, this slide, I don't want to spend too much time on this because we have other things that we want to cover, but this is really an important shift in the marketplace. It's significant, and it's something that we need to keep our eyes on as employers, because we obviously want to make sure that we keep the carriers in the insurance market as competitive as possible so that we still have leverage to negotiate. This is something that's near and dear to my heart. I'm just so excited about this new technology. I know our last power lunch that we did in August was regarding genomic and genetic testing, but precision medicine is something that's here to stay. And if you're not well versed on what this means to you and your employees, you should spend some time reading and investigating some additional information on this. I know the power lunch that I did last month is available via video, and it's very exciting. So just a quick tutorial. Genetics obviously is our DNA, and it's who we are as individuals, and it's our genomic makeup, right? So genetics and your DNA is what you're born with. And in 2003, they decoded the entire human genome, so they know the whole sequence now. And so that led into kind of the next generation of scientific discovery with genomic testing, understanding the genes, their functions, how your genetic code helps you metabolize medicines, makes you a candidate that would be better with one medicine than another. So it's a pretty significant shift in scientific discovery. And it's going to help us really, when you think about understanding the human genome and your genetic makeup and your enzyme level. We have drugs like tamoxifen for women who have recovered from breast cancer. And our tamoxifen specifically helps women avoid ongoing cancer cells from developing. And if you look at statistics, from 2016, roughly 2 out of 5 women were on tamoxifen and didn't have the enzyme test that would determine whether that drug could actually be effective in their bodies. So if you think about it, it was over $1,000 a month, and 2 women out of 5 were on it and didn't have the correct genetic or enzyme in their system to break that drug down and make it effective. So that's 2 things. One, it is a large cost, and number 2, the other thing that did was it raised costs and it left those women unprotected. So we're hoping with the predictive diagnostic testing for genetic, the genetic influence on how you take and digest medicine will make the rate of adverse effects go down. The cost should significantly go down with more appropriate amounts of drug and the clinically most effective drug, and obviously improve drug safety as well. So that is a significant shift, again, kind of in the marketplace as we see it. This is really interesting to me because this is the first time, the beginning of this year, 2018, healthcare became the U.S. Largest employer. So we, in healthcare and healthcare-related fields, outpaced manufacturing in the U.S. for the first time. That is going to have an influence on legislative changes and things that happen in our government. It also has a huge impact when you look at marketplace shifts and how things are covered, and really the influence of advancements in medicines and the pharmacogenomics, the medicines that are specifically genomically targeted. That's going to have a significant impact on the marketplace and employment, if you think about it in that way. This I'm sure isn't shocking for most people that have been tracking this and following it, but healthcare premiums for a family have increased 58% since 2006. So it's significantly outpacing inflation, and certainly outpacing raises and wages. And when you think about it, healthcare, really is going to continue to affect job growth and innovation and pushing back retirement. So as we look at the workforce and the baby boomers that are in the workforce, as people become less and less financially able to retire prior to age 65 due to healthcare costs and healthcare benefit availability, when we had Obamacare, which produced the public exchanges in individual states and federally run individual states, where people could go out and choose to purchase healthcare on those exchanges. People were able or are able today to retire before 65 and still purchase health insurance. With that shift and that change, that might stifle people from retiring on time. And certainly as our population as an employer under employer paid healthcare benefits, as our population ages over the median, for every year your population ages over an average age of 42 years of age. So if your population, your average age is 44, for every year it's over 42, it's attributable to about 3% in total trend on your healthcare expenses. So that's something also that's kind of affecting us in our marketplace. 1/3 of all healthcare spending, over $1 trillion a year, is unnecessary. And Warren Buffett called our healthcare system trend the tapeworm of American business due to it eroding profit margins, which is interesting. This struck me when I read this. These are kind of like all kind of pulled together to kind of tell us a story about what's going on in the marketplace. But Johns Hopkins did a study where they suggested that medical error is replacing the number 3rd spot as the leading cause of death in the U.S. So again, I think with the precision medicine and the genomic accuracy testing for the pharmacogenomics, I hope that will change this trend and medicine will become more targeted and more appropriate. So we'll see as that progresses whether that happens. I popped this slide in here because I wanted to talk a little bit about, the Fidelity Investment study that said that each retired couple today would need to save about $275,000 for their retirement period to pay for unpaid medical expenses. So that's things outside of Medicare coverage, hospitalization, and things like that. That is startling, I think, because the average American has less than $90,000 saved going into retirement. So this is specifically why we see the retirement age for most people being pushed back and people reconsidering when they're going to retire to make sure that they have enough saved for unpaid medical expenses and living expenses, which we don't seem to have quite enough in savings to meet those needs. Very interesting study, though, I thought. That struck me. No presentation would be complete without a little discussion on opioids. So, you know, it's interesting. How did it get so bad so fast? And really, if you look at it, it's 2014 when the synthetic opioid came out on the market, fentanyl, which was 50 times more potent than the Oxycontin and some of the pain medicine opioids that were out on the market. The interesting thing about this, so I was in Washington last in March or April, and I heard the Surgeon General of the United States speak about opioids, and he actually made a call to employers. So I was at the National Business Group on Health in Washington, and he reached out and he said to employers, this is something that you need to help with. So opioid addiction is something that is affecting all of us, whether it's, you know, your cousin, your neighbor, your son, your daughter. This is something that we all need to be focused on. And statistically, if you look at the availability of opioids, people aren't really familiar with what an opioid is and what drugs fall into that category. So that's the first thing, education. And then the second thing is limiting the quantity. So we've had some employers very successfully limit the quantity of opioids for a first script to 8 days, no more than 8 days. They say that's the tipping point. So anything beyond 8 days, you become significantly higher at risk for addiction. There was one employer in central New York that limited, a very large employer that limited their prescriptions with ESI to limit the script fill of opioids to 8 days. Actually, I think they did 6 days. And ESI pushed back and said, you know, that's not going to be enough. You're going to have a lot of people that need pain medicine that aren't able to get it. This is going to be a problem. And in the first 6 months, they had one complaint. And obviously, they made an exception, and that person was able to get additional scripts due to their illness. But that's something to think about when you're looking at your plan design and thinking about how you can help your employees and their families is really limiting that first script, because that's where the problem starts. They said 2/3 of people that get addicted to opioids started out with pain medicine for dental work or a medical issue. Artificial intelligence is something that, again, is really significantly changing the way that we look at the marketplace for healthcare. It's definitely moving us forward in kind of how we see, you know, artificial intelligence playing into how people get care and just the resources. You know, physicians are saying that there's massive amounts of data coming at them every single day, and they're trying to see their patients and they're trying to stay abreast of what's going on in the marketplace. Oncology is the biggest, with 2/3 of oncologists surveyed saying that they can't keep up with what the marketplace and the most prevalent treatment paths of treatments are in the marketplace today. I heard one of the 11 hospital systems that focuses just solely, it's a cancer facility, and talking a little bit about AI and how it's, in essence, collating 8,000 pieces of data a day into a system where doctors can use the system to put in the patient's clinical information, the lab results, and coming out with, here's the best, latest, and greatest treatment, here's who's doing it, and here's the success rate. So that is actually going to move the mark on quality of care, the cost of care, and the increased prognosis and diagnosis and outcomes being at a much higher quality and a higher level. Interestingly, again, taking a step back and thinking, how does this influence us as employers? There's a lot of companies, even mid-sized companies, that have design programs, value-based plan designs, where if you have any type of cancer, there's a concierge service that does kind of the vetting for them, right? And there's a lot of them out in the marketplace today. Best Doctors is one, where they're using artificial intelligence to take that person's diagnosis and get them to the treatment that's best suited for that particular treatment of oncology. Interestingly, I believe it was Walmart. There was an article in Time magazine a couple of months back where Walmart developed this oncology center of excellence, and they were sending their members to the Cleveland Clinic for a second opinion. And out of 10 people, 8 of them came back with the same diagnosis. 2 people came back with completely different diagnoses than they went in with. They didn't even have cancer. So it is startling that getting people to the best facility the first time can significantly increase their chance of survival and lower the cost and raise the quality. Interesting how that's happening. Of course, the AI industry is growing by leaps and bounds. My son was telling me that there's an artificial intelligence engineering class that's going to be available to him, and I thought that was pretty cool. So there's a systemic shift here where computers and AI are helping determine the path of treatment and really aggregating tons of data that's out there in the marketplace for us. This was an article that I thought was really interesting because they're using AI to perform different diagnoses and really move the mark on being able to diagnose things that went undiagnosed until later. There's an eye exam that can determine heart disease. There are new contact lenses for diabetics that get 8 to 10 hours out ahead of an event for them by measuring their glucose levels through their contact lenses. So as this kind of moves forward, it's kind of scary sometimes to think about, especially some of the genetic editing that's going on. But it is going to be a very interesting ride for the next two years. I think for the next 24 months, we're going to see a huge shift in how AI and genetic testing and genetic editing is going to influence how we receive medical care in the United States. Which brings us to our last couple of slides. I only have 3 slides left, and I know I kind of went fast, but this was kind of trying to give you the macro view of what's going on in the industry. It really is interesting because if you look at the last decade, we were all about cost shifting onto the employees, right? So we developed the high deductible plans with an HSA, and we kind of wanted to have our employees have a little bit more skin in the game, right? And be a little bit better consumers. And now we've shifted from that thought a little bit, because if you really look at what's driving our cost, it's specialty pharmaceuticals and high claimants. And if you really think and you look at your utilization, and I've spent a lot of time in the last 6 months looking at utilization and developing strategies for my clients, and it was significant this year that the high claimants that are driving 95% of your costs because of the specialty drugs and some of the specialty therapies. So the high deductible plans were a good idea, and it's great that somebody goes to the pharmacy and says, I don't want the $300 prescription, it's coming out of my HSA. I'd like to know if there's a generic alternative, but that's not going to move the mark on trend today, just because our high claimants are driving things. Where, I'm looking at employer cost, of 8 to 9 million a year, and 1 to 2 million of them are spent by 2 to 3 people. So that's really where you need some intervention on specialty pharmaceutical management and high cost claimants, things like concierge services for oncology patients, because oncology is definitely a driver in that bucket. So some of the solutions that people are deploying, and these slides will be available for you to look at later, but pharmacy benefit management, there's a lot of new technology available to employers to make sure that somebody's actually looking at your specific drug utilization and saying to people that, maybe could go on 4 pills a day, that's on, of one particular oncological medication, where they can, they're on 1 pill a day, and by shifting to 4 pills a day, it could save you $28 million or $28,000 a year for that particular patient. So really looking at the clinical programs, the way your programs are set up and designed, and really looking at the formularies to make sure that the least expensive drugs are on the formularies and you're pushing people into the most clinically appropriate medication at the lowest price. High cost claimants are another category where centers of excellence and concierge services are being deployed more and more as a way to kind of hone in and make sure that we're using our healthcare in the most effective manner. So this slide wraps up, what are the challenges? 70% of, our costs are avoidable. 55% of our population are driving 50+% of our cost, and we have chronic illnesses that are driving our costs as well. So employers, what I'm hearing from employers are, I don't know what I don't know without looking at the utilization data and having specialists look at the utilization data and tell me exactly what's going on so that I can implement good clinical programs that will not only save me cost and reduce the cost and keep my benefits more affordable, but will also benefit the employee by making available to them the cutting edge technology that would be available for their particular illness, and the quality and the best, the best place to go for the best care. So that kind of wraps up our event for today. I know I kind of went through a lot of information. Next month on October 10th, we're going to be looking at the surveys that were done this summer. So there were 3 to 4 really large surveys from mid-sized to large employers on what's driving your cost, what's happening for 2019, what changes are you making, and what strategies are you deploying. So next month, we're going to spend 30 minutes kind of going through what the survey said from large employers and what the most valuable strategies that are being deployed. And then, of course, we have the Las Vegas conference coming, September 30th, Sunday through October 3rd, Wednesday. I will be a keynote speaker there, and Kelly has been so kind to offer everybody a $200 discount if you want to sign up with that registration is on the screen. And of course, next year, she let me, they're not being released until tomorrow, so you folks on this webinar are privy to the 2019 upcoming conferences where, again, you'll get a $200 discount if you register with that code. So we have San Diego in March, Boston in May, Chicago, of course, again in June, and Nashville is a new venue for us in September. So we hope to see everybody there next year, and feel free to reach out to Kelly at her website to register for her conference events. Anything to add, Kelly?
No, thank you so much, Marybeth. Excellent information, awesome webinar as usual. Any questions that came in seemed pretty specific to that individual or their company, so I'll just shoot those to you, Marybeth, and you can follow up with those folks individually after the webinar.
Great. Sounds terrific. I'll make sure that we get back to everybody by the end of the week.
Wonderful.
Thanks.
Thanks again, and if any of you are in North Carolina like we are, stay safe, good luck, and we'll see you next month for the Power Lunch. Have a great afternoon.
Yes, indeed. Thanks.
Bye-bye.